Let us now go to visual diagnosis of the limbs. The topic is edema of limbs and its acupuncture treatment. For spleen Yang deficiency, there will be pitting edema of the limbs and abdomen, cold limbs, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, feeling cold, pale and wet tongue with a deep, weak pulse. The acupuncture points to be used are Ren 12, stomach 36, spleen 6, and bladder 20. For kidney Yang deficiency, there will be pitting edema of ankles and legs, weak knees, lower back ache, cold knees, feeling cold, bright white complexion, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and wet tongue with a deep, weak pulse. The acupuncture points to be used are kidney 3, Ren 4, bladder 23, kidney 7, and Du 4, using moxa as well. For dampness, there will be swelling of legs and ankles, ache, swelling, redness, and heat of the joints, hot limbs, sticky yellow tongue coating, slippery rapid pulse, and other symptoms and signs depend on the organ involved. The acupuncture points to be used are Ren 12, Ren 9, spleen 9, Ren 5, and bladder 22. For chi stagnation, it is a non-pitting edema of the limbs, but there will be a feeling of distension of the limbs, the skin springs back on pressing the swollen area. The acupuncture points to be used are gallbladder 34 and liver 3. For lung qi deficiency, there will be pitting edema of hands and face, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, dislike of speaking, bright white complexion, propensity to catching colds, tiredness, dislike of cold, a pale tongue, and an empty pulse. For cold dampness, there will be swelling of legs and ankles, feeling of heaviness of the limbs, cold limbs, ache in the joints, feeling cold, sticky white tongue coating, and a slippery and slow pulse. For qi deficiency and blood stasis, there will be edema of the limbs, cold hands and feet, numbness of the limbs, muscular weakness, purple color of hands and or feet, tiredness, poor appetite, loose stools, weak voice, a bluish purple tongue, and a choppy pulse. For wind water invading the lungs, there will be sudden swelling of the eyes, face, and hands that gradually spreads to the whole body. Bright shiny complexion, scanty and pale urination, aversion to wind, fever, cough, slight breathlessness, sticky white tongue coating with a floating slippery pulse. This is an acute type of edema, and this pattern is a type of external wind cold. Thank you so much for your attention.